We'll do roll call.
Galen Becker,
Here.
Senator Dever,
Here.
Jim Holm,
Here.
Leslie Piercy. Here. Trevor Vanette,
Here.
Chelsea Flory,
Here.
and absent is Commissioner Matthews and Tracy Famous.
Yeah, and they did give me a heads up, they won't be here today, so they're not gonna roll in late on us, they're just not here. Next on the agenda is the approval of the meeting minutes from our June 20th meeting. If everybody had a chance to go over them, any comments, questions, or anybody wanna make a motion? Do I have a second?
Second.
Thank you. And I'll just do all in favor.
Aye.
No opposed. The next thing, we'll just get right into the director's report. I will start with economic assistance. Try to take some notes for you guys. Right now, we have one, I'm gonna call it like a pending, position that we're just looking at, where do we fill it? We're just trying to look at where the need is within the economic assistance team. So right now they operate in groups. And then there's also the call center, there's support specialists. So we're really just trying to look at where within our region we feel like that FTE would be placed and best to be filled. So that's the only open position we have. I think the biggest thing that we talked about last time and to continue talking about is the call center. So right now we still have the contract for, this is a statewide call center. Deloitte is the contract that, or the vendor for the contract, and what they do is they operate within the tier one of the call center. They have 30 positions for that tier. Last report I had was they only have 24 of those positions filled though. So really what's happening is when somebody calls in the call center and goes to tier one, those are really like your easy to answer questions that, so we can continue to keep up with the calls that are coming in. If the call is too complex, it gets escalated to tier two, which is really more so of our zone workers across the state who have that economic assistance experience to dive a little bit into the case more. We're seeing really good success with the tier one. A lot of questions are getting answered through that, but that concept was not initially part of the call center redesign. I think it's been helpful because now when we are hiring new workers for call center, they can start in the tier one and really work that place for the first 6 months until they move. I mean, that's the goal, is like 6 months training until they move to tier two. So I think that wasn't, again, part of the initial plan, but I think that that's been a good change as we have been going through the growing pains. This Deloitte contract, I asked how long it was supposed to run, like how long we can expect this temporary relief of those 30 positions. The contract started in May. They were thinking 6 to 12 months. So that'll kind of just be assessed as we go. I think it's interesting because it'll help us gauge if we have the right number of workers in that call center. That's obviously 30 positions is pretty significant to be helping in the call center. So do we need that many long-term, or was that just kind of while we got our feet under us and figured out some of those growing pains? So happy to report that the current average wait time that we got for July is under 2 minutes. So I feel like we are getting better with the call center. It was pretty rough when it started. If anybody kind of heard from any of their community members that now we're under that 2 minute mark. So that's really good. One of the things that we're doing with the call center is they have a program that really looks at the capacities and the areas of need. So it's not just looking at like the statistics or the performance so much. It's really looking at the number of calls that are accepted, the number of calls that are missed, the queue time, the worker status. So we can, as directors, ask for that data for our employees that are working there, and it'll show me like how long did they spend on calls, how long were they away from their desk, because a lot of our workers are remote, so they're not, I can't just walk down the hallway and see them. So this is a really good thing to look at capacity and then really help advocate for if we need more of those workers. So the next part for the call center is they're working on hiring a call center manager. So this person will oversee the operations of the call center. That's a state position, so it's not tied to any one zone. This was advertised like nationwide because they wanted to really get somebody who not so much had knowledge in North Dakota's policy around our economic assistance programs, but really knew how to operate a call center of this type. So that position was posted. I believe they're conducting interviews. So that person should be hopefully starting within the next month. So other thing for the call center is there was an ask then, you know, to say like they're in crisis, but we were seeing the high call volume and they are seeing some turnover in the call center. So they did ask zones to identify, so we operate as a region, so within our region to identify 3 workers who would be willing to go work in the call center temporary for 3 weeks. So that was a huge ask. I feel like on our team, because people were told that you're going to work in this group with this program, and now I'm coming back and asking if you temporarily will go work in the call center. So we did have a lot of employees who offered to do that. So what we're doing is 3 workers will go do that for 3 weeks, and then we'll rotate in 3 more workers for 3 weeks, because it is a lot to sit on the phone for that amount of time. So, and a lot of burnout. So this, we're planning for is a 6-week temporary relief. And then I think as directors, we're going to reassess, did this help? One of the concerns is if I'm pulling workers from a group, if they're running Medicaid applications or SNAP applications, will they see backlog then in those groups? And then we're kind of perpetuating the problem because more people are going to call in the call center because their benefits are being delayed. So one, it was just a kind of like a bandage on the situation and the crisis, but we need to look at, did this even help? And if this helped, do we move to other groups throughout? We're really focusing just on our TANF group right now, but then if it worked, do we want to kind of spread between the other groups as well? Another thing we did to help with the call center was shifting emails to, we have a group of support specialists across the state, and so we shifted emails to that group to try to help level their workload. So overall, I would just give kudos to our team at Burleigh County, our management team, and then their workers for being willing to step up and do these things. We've gotten a lot of kudos from the department regarding their flexibility, their positive response to this change. I think a lot of them are experiencing, I would say, like change fatigue, like they can't get their feet under them. They're told this is what you're going to be doing, and then like it just keeps changing and changing. So I know it's been a lot of burnout and frustration for them. They do a really great job, like hearing, like the supervisors hear their team's concerns. They're definitely bringing them to me. I'm advocating how I can. They do so appropriately and professionally, and then, but at the end of the day, they are just filling the need for the customers and the clients that we serve. So I would just give huge kudos and proud of them for just seeing that we just need to do what we need for our clients in our area. So the next big thing that'll happen is the LIHEAP season will be starting. So this is like your heating assistance program. They'll start taking early apps in September. I think it's September 15th, and then October, all the other apps will start coming in. So we're again trying to be pre-planning the workflow to prevent any backlog, because those applications are time sensitive, really to get those services going for families. So any questions so far on the call center or any of that?
How did it go with the holiday on the 3rd?
Good question. I don't know, just kind of like the crisis that they were in anyways. I don't know that the holiday really, I mean, they're just already short staffed. So it was just shorter staffed for definitely, but Commissioner Matthews can't be here today, but she did tell me that I should really be looking at having conversations with the commission about that day after Thanksgiving where we're going to see that happen again. And if our staff will be given that day, because again, what Trevor's basically referencing is that in the event we're not, that's a local county decision. So if our county doesn't do that, then our staff end up operating that call center very short-staffed.
And how many other zones again did give them off?
I mean, there's 19 zones. I can't remember, but it was over half of them did. But it all just depends on like who actually has employees in the call center. But I don't remember the exact number, but we were one of the few that did have to continue operating on that short staff day.
You know, I think a motion needs to be made by this board to recommend to the county commission that we support the employees. I really do. I just, I don't think it's fair for them to have to work when other zones don't. Or some do, some don't. We need to treat them fairly.
Mm-hmm.
So.
Yeah, and you definitely can. That's always helpful as I'm behind the podium to the commissioners to explain that this board does support that. One thing I think to also think about is, they have a call center for like centralized intake for child abuse and neglect reporting. And what they have done at times is if like a majority of people, like those workers for those certain zones are gonna be closed, they just opt to shut that call center down, because you still have local response for like any present danger emergencies that are happening, and then we still respond on call. When we've brought that up as directors, there's still not, I mean, if somebody's calling in for their economic assistance or their SNAP card's not working, there is no other avenue, so they really feel like it should stay open. So just wanted to like make sure that you guys knew as you're motioning that it has been talked about.
Who thinks we should stay open? Is it the department?
Yeah, I mean, I wouldn't just say it's the department, I think it's, as even directors, we know that if you shut it down completely, then constituents don't have any avenue.
Well, I think, looking at the holidays and stuff, and obviously this is a discussion that comes up in all the departments within the county, and I'm sure the city struggles with this from year to year and what they decide, and ultimately it is up to the commission to make that decision. But you always got to look at like what we already provide to the employees, being fair to the people that use those services. So I think you have to look at it in a little bit more of a broad stroke, or the 30,000 feet than right on it. And that's where I kind of go back to, I mean, I'm all for, taking care of the employees. They are the greatest asset you can have in a business, and this is a business, to take care of them. But you also have to be fair to everybody in that business, all those employees, and to the people that you serve and the product that you put forth, in this case, as a service. County employees receive 10.5 holidays throughout the year, which is, I'm reminded of that by my significant other, that they don't receive that many. So we already receive more holidays than the normal worker in private sectors and in other areas. So I think it's something you have to keep in mind too, because it's also going to come with a fiscal note. The sheriff's department and the detention center is 24/7. Every time we close for a holiday, we still have to pay those people. So it's costing more money. So I just think we have to look at it a little bit more broad, and ultimately I would defer that decision to our commission. That's their decision. That's my thoughts.
No, those are really good points. I appreciate you sharing from another county entity the impact that it's going to have. It's not just us. I mean, if they decide to do it, it is all of our departments. So I don't know that we can make a motion. I don't know what part you want to motion, but I do, talking with Commissioner Matthews, she, as my portfolio holder, did ask that I go to the meeting. I mean, we still have some time. It's not till November, so I'll definitely plan with her which one to go to, but that is my intent, is to talk to them about if we'll get that day. Any other feedback or comments on economic assistance or?
No, I just think, it would be helpful. I think, because they'll ask what we want to do when you're up at the podium. So if you talk to your board about that, I think they're really going to be picky about that. Because there was a big mess in Senator Devereux. He was on the board before. I think the county's going to rely on this board to make some of that decision too. And Senator Devereux, because when you were on the board, it was a big mess at first on what the county was supposed to be doing.
It's a fading memory.
Yeah,
Trying to replace it with some better memories.
yeah.
Yeah, I mean, I think you're right that it is good for them to know that you guys support it. So I think the conversation I'm going to have is that we're concerned for the burnout on our staff, and that's really, but ultimately it is up for them to decide what's best for the county as an entire, so.
Yeah.
So I'm comfortable with advocating for them and just saying that,
Okay.
such as that, but The only other thing that really would fall under the economic assistance is the indigent burial. So that was during legislative session, a bill that had gone through to talk about the new rate. So previously, the rate for that was 2,100, and that was our rate, I should say, but it could vary from county to county, depending on the host county for the zone. So what we have now is a flat or standard rate statewide, that's 3,500. So in the incident of, we're notified of indigent burial applications, that's the standard rate we're doing. So that's been helpful. That's been helpful for budgeting for zones, so. Any questions on that program?
Doesn't that assume cremation?
Oh, yeah.
Remember the discussion that if for religious purposes you were opposed to cremation, that the state would fund it
Yeah.
at a more significant level?
Yeah, so that was a huge conversation during that bill, because that's really what we do for burial, but then that's what we do for the cremation, but then there are some religions that, they didn't want the cremation, they want a burial. So that was part of that negotiation to get to that 3,500, so. I don't know if that helps answer your question.
Well, I think at one point they were asking for 8,500.
Correct. Yeah. So that was negotiation that took place between the Association of Funeral Homes, I'm going to say, and some of the religious groups that provided testimony, and then ultimately the department really coming through like what fiscally, based on the average number of indigent burial requests we get, what we could budget and afford. So, yeah, hot topic. That's really all I had for economic assistance. I mean, I'll just say it's kind of just plowing through a lot of the changes, a lot of the kind of unsteadiness of the redesign, but I think we're seeing some wins, and then we're seeing some places that we should have maybe done things different before we rolled it out, but I think that comes with a lot of things that change, so. All right, regarding our child welfare unit, we have a trainer position that we onboarded July 23rd, so that was a new position to our team. This was a current employee that ended up securing that position, so there's really a transition, but the ultimate goal is that they'll carry a small caseload from our case management team as well as our child protection team, and really help with some of that onboarding and training for our newer employees, going out in the field with them, taking some of that off of our supervisors so they can really do reviewing of affidavits and like reviewing of documentation and some of that supervision versus trying to get out in the field with their staff and do that field work. Some of the things that they've already started working on is doing some training with the staff. With school coming up, we have to update our custodial kids in like Power School. There's some different things they have to do. So they've done some training. We've had a lot of new staff in our foster care unit. So making sure that they know how to do that. We've also talked about doing some training on entering court orders into our system, and court orders that we receive that we have to enter into, I'm going to say the state system, impacts payment to foster parents. So they are very important that they're entered correctly and timely. So, and again, we've just had like a lot of turnover that a lot of our staff now we have some that have met 2 years, and so we're seeing, you're seasoned after that. But yes, I think it's really, this position is going to be helpful. We're focusing on the case management with the idea that eventually we'll get her more experience in the child protection part of it so she can help do that. But right now they have a lot more years of service under that unit, so it's just not the current focus. Any, I guess, comments or feedback for this trainer position, things that this board thinks that they should focus on or would like them to do? Suggestions?
I just think it's exciting that you have someone focusing on training your new staff and bringing consistency to what case managers are doing and how they're handling certain situations, or a resource for them to bounce ideas off of other than a supervisor, that they can say, hey, what do I do in this situation? So there's a lot to learn.
Yeah, 100%. I think it'll be really good to there's so many techniques that you use as a worker that you just need to pass along to the other workers, and how to engage with foster parents, how to build rapport, how to prioritize the work that's coming in, all those little things. So this will be helpful. This worker who is in this trainer position, I would just share, we do case reviews, either their quality assurance reviews, which are kind of part of a federal audit, I'm gonna say, or we do fidelity reviews, which is just like a state review on how we're doing our work. This specific worker, when I sit through their review meetings where we get to digest the results, really good results. And it's gonna be hard to lose them as a frontline worker, but I'm really hoping we can now just copy and paste them to these other workers. But really good results that we see from, as far as their family engagement, their work at reunification, the engaging both the mother and the father. I mean, there's just so many things that this worker gets kudos for that I'm excited for them to share with the rest of the team. Openings within the child welfare unit is 1 in-home case manager, 1 foster care case manager. We also have a transporter position. That position took us a long time to get filled, and unfortunately that's already going to be vacant again. So we're going to work on that. That's a tough position to find somebody to fill, so.
Is that because internally there's movement, or they left?
They left, yeah. It's just it's kind of like an entry level. It's not, so it's a harder to retain type of position. So we've had discussion on how to fill it. I mean, do we look at having 2 part-time positions versus 1 full-time? Like, how can we get creative? It would be a great position for somebody who potentially is a college student who's looking for some flexible time. So we're having conversations. It's posted now. We'll see the pool. If obviously if we can fill it, we want to fill it. But if not, we'll look at how to adjust the position. It's needed, definitely needed, because if this person can be doing the transports to and from school, to and from visits, to and from therapy and appointments, it allows our case managers to be doing that higher level of work. So.
And the reality is school's starting and the whole city's under construction.
Mhm.
So everyone needs help with transportation right now.
Yep. Oh, yeah. I think we all enjoyed those summer months, and it'll kick right back off, so. Other things for that unit would be, we're in some different work groups through legislative session. There came some studies, so I have a worker who's part of an adoption work group. So these are statewide work groups. We were able to like volunteer somebody to be a part of it. So it was important for me that I asked my team if they wanted to. I know that their workload is very high right now, but I think it's important we have a voice in some of these work groups and how things are going to go. So I have a worker who's on an adoption redesign. We have a worker who's on like a human trafficking a work group, and then there's a kinship work group as well. There's also like a workforce development work group that I believe we had a worker be selected to be a part of. So those like all just kicked off. I don't even have updates for you on how those are going. I think they've maybe had their first meeting or 2, but these are, I think the idea is that these work groups will run through end of the year. So I don't know, Senator Dever, if you have any, I mean, from legislative session, if you heard of any of these work groups that were asked or anything like that?
No.
No. Fair. Other thing that we're working on, before we went on live, we were talking about retention and recruitment, and one of the things when I think about retention is the vicarious trauma or the secondary trauma that our workers experience. And this summer we've had a couple cases where there's been, I'm going to say like a parent death within the caseload. And sometimes you could go a year or 2 maybe without experiencing that, but we had a few of them. And there is impact to our team on those. They really build relationships with those parents, those children, and then having to help support the children through that grief. We were able to reach out to the Children's Advocacy Center. They had done like a grant funded program where we could do this resiliency therapy. That funding has since ran out. They were very kind and allowed us to use some funding they had in reserve for their own team. They have offered us to, I'm gonna say like pay into to use this service, but I'm trying to figure out the best way to do it, because we offer through the county like EAP services for employee assistance, but that's really, in my opinion, geared towards like their own maybe personal issues they're going through. The state of North Dakota contracts with a vendor for, I'm trying to think of how to for like team building or some of those kind of things, it's not really geared toward these kind of things, like the complex nature of this trauma. So I have talked to the CAC about doing like a contract thing. They expressed me, this is what they ended up doing with Fargo PD. They kind of came together, and what they do is like a pay-as-you-go. So they would give me a rate, I think it was like $162.50 per session, and then they'll just bill me for what we use. So what I have to do is really look at an average of how much, I mean, it's going to be a total ballpark of how much I think my staff will utilize this, how much that would cost for sessions, and then really going back to the department and saying, is this something that they could fiscally support? So I don't know if that's honestly, the program has been very beneficial to those who took advantage of it. So I would advocate that I think it's the right program for our team.
And I think your team needs that.
Mm-hmm.
You know, I don't think it's a very custom thing when parents die or children die, and I don't think that EPC through the county will help
No.
with that.
And part of this program is they can do like a group debrief, and then after that, they could use individual sessions, and then through that, the goal would be at the end of this, our funding, that employee could choose to continue on with that therapist and now start billing through their insurance, or maybe they'd work through some of those things and then be able to go to, if they already had their own independent mental health provider. So just something I'm trying to look at to support the team better. Final thing for that unit would be, we did, I'm going to call them case consults. So we had the Department of Health and Human Services asked if they could send a team of their employees to come do case reviews or case consults, and we were the first zone to do this. So we were kind of their guinea pig on that. So they sent 8 of their staff here for the week, and we hosted them, and we were able to go through 31 of our cases. And really what they were looking at is, did we have the right level of intrusion or intervention for these families? So off of that, some of the straight statistics they gave me was 60% of our cases are ICWA cases. They felt that we had strong ICWA family preservation work. We work with our tribal liaisons very well. We are working with the Indian family preservation specialist who could be assigned to the case well. So that was good feedback. Of those cases, they felt like 81% of our cases were on track. We had the right level of intrusion. We were doing the right thing. So basically we have the right kids in care. They did provide on those cases, though, they would work with our staff on some goals and case planning. This was really helpful. Again, when I talk about we have a lot of turnover, you have some workers who are working cases that might have already been through 2 or 3 case managers. So as a brand new worker, you're trying to learn the whole history of the case. So this really served as that. They were able to digest that with this team, and come up with, like, are we doing the right case goal, or do we need to adjust the goals and the safety plan? So they found it very helpful. And then of those cases reviewed, 19% they said they recommended for closure. So they just felt like we've helped the family, they were at a good place, we should be like essentially vacating our order or closing our case. So, and again, those are recommendations. We obviously have to go through our local court, and they ultimately are the ones who hear our active efforts. So just kind of looking through some of their noteworthy observations. When we have concurrent goals, so if we have a family who we're working reunification, but they've reached a certain number of days in care, as we add a concurrent goal of adoption, some of their observation was we got to make sure we're working those equally. So it's easy when you get to that time frame, you know, and a family is not engaging and it's been 400 and some days to really just focus on the adoption. But until the moment that takes place, that termination of parental rights, we have to work both of those equally as aggressive. So one of their feedback is when reunification is not likely, move towards termination of parental rights for permanency. We do that. There are just cases where if this foster youth is maybe in a placement that doesn't have any intent to adopt them, it's hard to terminate the parental rights just to terminate them. Like if I had a permanency, 100%, you have a permanent option, but to essentially terminate the parental rights just for the child to remain in care, it does become a difficult decision to make because you still want to try to engage the family and there really is no other permanent option. So those are conversations we're having as far as how we're recruiting for those adoptive homes and getting creative and finding individuals interested in those adoptions.
That's interesting because I never considered that, what you just said in determining termination of parental rights. I didn't think it had anything to do with, do we have an adopted placement in
Mhm.
front of us, an option?
Yeah.
I thought it had to do with everything, with the efforts of the biological family.
Yep. Which is a huge driver of it. I think that is where it comes down to like an ethical dilemma for me of, for lack of a better term, like, we don't want to orphan children just to orphan children.
Right.
So if I had a permanency option, 100%, that's an easy decision. But to think that we terminate them and then they linger in care is a hard thing to do. Because maybe a year from them, that parent is going to start engaging. So,
Right.
part of session 2, we talked about the reinstatement of parental rights. And so I think there was going to be some conversation and studies around what does that look like? Let's say we terminate parental rights when a child is 9, this child doesn't have anybody, and now they're still sitting in foster care, and now they're 11, and parents are engaging. Can we reinstate those rights? So,
Yeah.
yeah,
Good topics for our September training.
Yeah.
Association right there.
yeah. I appreciate you saying that because there's so many times that I get calls from foster parents and I always want to support them. Like I said, I started as a licenser. That's definitely where my passion is. But there's so many times that I get asked to answer questions and every case is different. And sometimes there's confidentiality. So one foster parent doesn't know the full story. So when they're trying to support their peer foster parent, it can be difficult because I'm like, you're not getting the full view of what's going on. Like, does ICWA apply in this case? What are these active efforts? Where is the parent at in the engagement? And those are things that shouldn't be shared peer to peer. So it's a struggle on how to coach them to lean on each other for support, but yet trust us to do the work that we're doing.
We should cover that next month when we talk about permanency options. Maybe you
Mhm.
want to be there.
Yeah, absolutely. Whatever you want. One thing that they did provide observation is we should work on our motivational interviewing skills. So I think that's great. I think that's that's always a good thing. And then the other thing then for you, Leslie, is one of the noteworthy observation is reminding foster care providers, caregivers, so foster parents, that this is not a pre-adoptive placement, rather an effort to support growth and change within the family. So really, foster parents are fostering the family. You're trying to build a natural support so when these kids do reunify, maybe that family feels like they can naturally call you when they're in a bind or they need support or need something, so.
Yeah, absolutely. We've been trying to drive towards some of those things. Pride training could help that too.
Yes, yep, yeah. No, I agree. Ongoing training and however our zone can help with that is, I'm always willing
Been a
to.
great partner at this point in helping to push those topics out.
Yeah, I mean, we had really great, I'm just paging through all the feedback from our staff. Our staff just said that this experience felt non-judgmental. They were very helpful for very grateful for the help in getting to process the cases. They would definitely do this again. So I think it was a good experience. And like I said, we were the guinea pigs to this and we didn't really know what to expect when somebody says that the state's coming in to review or consult your cases. I think everybody took it, said 80% said overall it was helpful. So, yeah, I don't have any other thing for that. So the only other thing for this unit would be tonight we do have the foster parent appreciation picnic. So I don't know, we did send out for staff to volunteer. I will be there as soon as we're done with the board meeting, helping with setting up and serving food and tear down, that kind of stuff. So that is tonight. So I'm hopeful that some of my team was able to take some time to volunteer for that. But I also know they all have lives outside of this as well. So
We had a great turnout last year, and it was a good way to interact with foster families, so looking forward to it again.
anybody else have comments, questions, concerns for that unit? For other zone updates, really the only thing I wanted to make sure I talked about was I was asked to help connect with a group in our community. So this would be, I'm going to read their title directly off their letter, but it's the Liberian, Bismarck, Mandan, and Lincoln Community. So this is a committee of African-American minority groups in the state of North Dakota, and they just kind of reached out expressing some cultural concerns. They are, as members of this community are coming to North Dakota as a home base, they're wanting to make sure that we're aware of the cultural and being cultural sensitive. So I was able to meet with, I believe, like 8 members of their committee, and just talk about some of their concerns with us, what they think we could improve on. So through that conversation, it was really good to learn about some of the cultural differences and where we could do training for our zone staff, how we could engage training through the schools, as well as they're a huge access point for these kiddos. They talked about training for foster parents. So if kiddos from their minority group are placed in foster care, are we sensitive to some of these cultural differences? So absolutely. They even talked about recruitment from their community for foster parents, which is always welcome. Mm-hmm. So they have don't have the name of the church, but they have a primary church that they work with. So I did say that I'd go in and do any sort of presentation to the church on what we do, what we offer, and maybe help them create like a catalog of resources. Really, they should be an access point for this community. It's just no different than like the Native American Development Center serves as an access point for Native American culture. So just kind of being able to refer their congregation and their members of their community to these same resources that they can come to our door and get, but it may just feel more comfortable if it's coming from them.
Is there a
Director.
large population of Liberians?
They did not tell me that. So initially this letter went to the governor and then was just asked that we, as a local, that it help support them. So I, through the letter, don't see them talking about like how many. Keelan, do you have a question too?
Yeah, Dr. Flory, what are some of the cultural differences or issues?
Yeah, so some of the things is just like maybe what they feel is normalcy for their culture. So we talked about like hair care. So if a kid comes to school and is like, my mom was brushing my hair and it hurt, it's not that the parent was doing it out of aggression or to harm the child. They just talked about the texture of the hair, and the braiding of the hair can cause pain. So just when our workers or our school staff are engaging with these children to, take that into context. So that was one thing we talked about. Some of it could be talking about the kinds of foods they eat. Their foods that they eat are spicy. So if a child comes to school and, if my child says I force them to eat spicy foods, that's going to look different than somebody of their culture. So it was really just things like it was really good information that I think we could always be aware of, no different than our Native American culture when we're talking about things that they believe in. Yeah. Yeah, they came fully prepared with the way forward. I mean, they talked about a liaison, and I should say that the department was part of this conversation I had with them as well, because some of these things are larger than just me on a community level. They talked about ways that we could support single mothers with childcare services. That's, I always think, is important, because what happens is you put a single mom into the position of, do I work and provide for my family and put food on the table, and then potentially leave my children in situations where us and our culture are going to feel like it's inadequate supervision? Or do they stay home with the children and then they don't maybe have the self-sufficient work that they want? So I think they had really good concerns and good feedback. So I'm excited to see how we can engage with them. Yeah, I don't really have anything else. I just wanted to share that with the board in case anybody had any other questions. I do think it's important to follow up on the number and how many they're seeing coming into our community. So that's all for that. Next on the agenda would be public comment. There's nobody here to comment. So we'll go to other business. I don't know if anybody else has anything else they want to talk about. I tried to think if Commissioner Matthews was here, what would she say, but
Well, I was curious how she's doing. 'Cause didn't she at the last meeting suggest that she might be missing more often.
Yeah, and she's been staying in pretty good contact with me as my portfolio holder, communicating with me as she can via email. So yeah, she's just still continuing to address her medical needs, so. Otherwise, I tried to send, I think I sent everybody an invite for our next meeting in October. So if anybody has anything they want me for topics, feel free to email me and I'll make sure that I gather data or information around it, but
It's October 16th, right?
17th.
I was gonna say, I think it's 17th,
Yeah.
yeah. Hopefully I got it to your calendar on the right date. Yeah, other than that, I don't have anything else, so we'll just adjourn the meeting.